Good day, everyone. Today we're going to talk about educational preparation for rural and remote practice. So we're going to talk about the rural. What do you mean by rural and remote? How do we prepare for this? Because we thought when we go to US, we'll be working in the city. Sometimes it's not that different, no? Here in the Philippines, we live in the city, we work in the city, but sometimes we go to America, there are still rural places, no, or remote places will be assigned. No? Like we're assigned to a province or to a barrio. Of course, the pay is good, but can we adapt? We expect that we are in in America, but we should be in the first world country, and we thought that it's more on high tech. But sometimes we get disappointed. Of course, this today, we're going to talk about it. So, internationally, there has been an increased interest in improving the quality of rural health and rural healthcare services. Well, internationally, even locally, here in the Philippines, that's why we created a lot of programs, especially Department of Health, to improve the healthcare services that we offer in remote areas, like just like doctors to the barrio, wherein you have after you avail this kind of scholarship program, and when you become doctor, you will work in a remote areas. So we call it as return service for at least 2 years. So can we? That's one program here in the Philippines to improve the healthcare services. In the US, there is a lot of that. Will be assigned in a remote areas as a mobile PT, no? In a small town with a population of maybe just 100, and the distance of the houses are about uh, the nearest neighbor is a mile away from the next house or from the house that you treat. So that's an example of one way of uh, increasing the rural healthcare services, because their youth also goes to the city, just like here in the Philippines, wherein the young individual seek their career in cities. They would rather stay there than stay in the provinces or in their barrios. So the reason for these differences are complex. There is widespread agreement regarding the lack of quality of healthcare services for rural citizens. So even there abroad, the citizen there is suffering from the lack of healthcare services in the rural areas. Sometimes there are no doctors. Sometimes they need to be airlifted in bigger cities if they call for help. Just like here in the Philippines. It so happened that we don't have the capability to do what they are doing in the first world country, wherein they just could call 911 and they could be picked up by the 911 services. But of course, it's not free. You have to pay. So we thought that 911 is free. But it's not. If you call the 911 and they respond, you have to pay. No, they charge you, because how are they going to survive if you will not pay? But here in the Philippines is different. If you call 911, that's free service, no? Except that if you go to the LGUs and you're considered non uh, dili ka pobre, bayron gid ka, magamit ka sa ilahang ambulance, no? Inana siya. So a significant component of this underservicing is attributed to the shortage of healthcare professionals. So they have shortage in healthcare professionals. Here in the Philippines, we have shortage also. But the good thing there is they entice people to work there by offering higher salaries. Whereas here in the Philippines, we are enticed to work here by mm, offering a study now pay later program. Uh, what else? Enticing us to be what? In prison or uh, not be issued with visas or with the pertinent documents that we need in order for us to go abroad. Just like what happened during the COVID, with the surge of COVID uh, virus in Europe, that they demand more nurses and they recruit nurses coming from the Philippines, and our government imposed a what? A moratorium or a ban, no, of sending these nurses to UK or to Europe. So it's a little bit a negative, no, negative way of, shall I say, uh, coping with the demands of the needs of the rural areas. But actually, it's not even rural; it's the key cities, no? Lack nurses in CR, Cebu, Iloilo, Cagayan, Davao. These are key cities. These not even rural areas, which they lack nurses, even doctors at the time, or even up to now. How much more in the rural areas? So, rural community focus on the recruitment and retention of healthcare professionals in an attempt to remedy the shortage of healthcare providers. To be successful, new recruits need to develop unique rural practice skills. So, supposedly, the the government should offer a more comprehensive program on how to retain and recruit graduates to work here locally, more in more positive way, maybe offering them higher salary or offering them more scholarship program so that after they graduate and they become professionals, they should return service first, but of course with a above minimum or above average salary, so that the nurses would not work as if it is just for formality sake. So the majority of practicing rural health care providers do not have postgraduate education related to the challenges of rural practice and have difficulty assessing the training once they are practicing. This challenge can be addressed by including training for rural practice in the professional education of healthcare providers. That's why we have now the community-based rehab, we have the intro to clinics, we have the community development program, the health and wellness promotion, because these are all part of developing rural health skills. Okay, uh, there's part of training, but of course, in order for you to become even more skillful, you have to undergo or to enroll in postgraduate courses. Now, if you're nursing, you have your community health nursing, no masters in community health nursing. For PT, you have a masters in physical therapy. even the PT if you go abroad. Because when you go this, the training there is different. It further enhances your skills in not only in treating patients but as well as in community relations. The next, what is rural? That is the common question. What is rural? There are commonly described physical, social, institutional, and cultural characteristics of the term rural. The rural practice environment is characterized by low population density, vulnerable and fragile organizations, and small populations with long travel distances to other communities and healthcare providers. So as I mentioned a while ago that the nearest neighbor that you have would be about a mile away. That is, and of course the population is very low. Sa isa ka baryo murag 15 ra ka balay, 16 ka balay, nya ang distansya sa kada balay tag isa ka kilometro. No? Before, way back 1980s, if I would describe the place where I was born, our house is located in the midst of uh, sugar plantation. But of course, it's not ours. We have only a very small land. No? So our land is located in the middle of that sugar plantation, or we call it a hacienda. So um, pinakaduol na mo nga silingan, siguro mga isa ka kilometro ang distansya sa balay. So kung manawag kag tabang, dili po kay wa pa may cellphone sa una, wa pa may telepono. Manawag kag tabang, naghimo ang akong amahan og he made a bamboo drum, no? Na bitong dako nga punuan sa kawayan, yan ang gilungagan sa tunga, no? Iyang gipaugad, gilungagan sa tunga, din yan ang tuktokon, no? Murag Morse code. Madunggan siya dito sa unahan sa among silingan. So kung mag-sound na kabalo na ang silingan na problema. So it's either mana siya sa balay o or kami mo adto dito. But usually kung kinsa ka nagpatingog mo na anhaan. No? So yun na. This is considered as rural. Wala pag kuryente. No? Mo ginagamit gesira. So wala dili uso ang stove, dili uso ang refrigerator. So many examples sa mga rural areas, no, in terms of its physical appearance. Social, makakita ra kasi imong silingan kung mahulam kag bugas na kay uslan ni Juan umadto ka dito or sila po na ituyo nimo. Or sometimes mag-abot mo sa kung asa mo magbuhi sa inyong mga binuhi nga kabaw baka, no? Dito mag-abot dito ra mo maka socialize. Ang hospital layo kaayo, walay community nurse nga nagasuroy, dili kuan ra, no, midwife, yung midwife pag yun sunduonon pas balay kung may problema sa inyo. So yun na siya. Other characteristic of rural practice environment have included geographical isolations, increased dependence on computer technology, minimal contact with supervisors, support network, and cultural variation of caseload. So, these are no, common, no? Okay na karon kung kay ang rural, maabot naman ang kuryente karon sa mga dito nanay kuryente. So, nanay TV sa balay, nanay electric fan, nanay refrigerator, but still, ang among pinakadool nga silingan layo. Nanay cellphone, so makatawag na mi dito sa akong magulang o sa akong mama. Pero ang mga nurses dito, murag yapon, minimal contact ra. No? Sa supervisor, in fact, ang barangay pinakalayo kay ang barangay hall. So, wala nagasuroy nga nurses kay but I don't know where's the money is going. So in addition, the literature identified the notions of the small town community culture as influencing confidentiality and role of practice and community appreciation of services. So ako, let's say for example, way back in 1974, I was born in just in our house by means of a midwife. A midwife gisundo pa. Akong mama nanganak sa ko 43. Menopausal baby na. So my mother almost died because the when the midwife was pitched by my father and so it took them almost 2 hours or 4 hours of walking, no, back and forth, no. Papa pa dito duha ka oras pagbalik another 2 hours. So inana. But it's a good thing napanganak niya po ko, then gawas ko. So inana siya. So ang mga na-assign dira sa community sa rural health center nato, actually they were loved by the people. No? So wala ibayad ang or wala tud sila ka bayad pero usually bonansya sila kay ano ang ihatod sila manok, chicken. So kung ikaw rural health practitioner diri sa ato sa Philippines, would you like that? Ang sweldo nimo dugay pero ang gihatod sa imo dito sa mga tawo nga imong giserbisyuhan kinaluoy sila sa imo kay wala po kay sweldo. Hatag sa imo balanghoy, kamote, manok, nangka, baboy. So nana no. So are you prepared for that? Of course, when you go to the US, it's a little bit different, but somewhat similar also that will happen to you. So what do you need to practice in rural area? The literature suggests that there are clinical skills and personal characteristics necessary for success in rural practice. These include effective communications, creativity, flexibility, resourcefulness, ability to problem solve, ability to manage multiple roles. No? So inana, so your these are the things, these are the skills that you need to develop so that you could live and you could practice your profession in that area. No? Let's take for example effective communications. So if you're going to the US, if you're again assigned to Texas, New Mexico, what communications you need to practice? So you need to develop your communication skills among the Hispanic. Basically, you need to speak Spanish, whether Mexican Spanish or isa pa, di na Spanish ang Portuguese, Portuguese mo gina siya, no? So, inana siya. So, you need to be creative also. Because there are times nga kulang-kulang ang mga gamit. So, kailangan creative ka. Flexible. May kadaghanan sa ito nga sanay man ta sa atong kinabuhi nga haruhay pag abot na sa glisod dili na maglisod og adjust no dili flexible. So dapat kabalo ka nga kung naa ka sa iyahe okay pod kung naa ka dito sa medyo pinobre pod no okay nga pa cowboy and manage multiple roles. So pag abot na mo sa community PT ka, nurse ka, doktor ka, because there are times nga wala na sila dito. Usahay gani, Doctor of Education ka, pero kay doktor man ang address nimo. Dito sila mangonsulta nimo. No? Manay ta ko ano. But of course, kung sa ato sa PT, Birkas Pilipinas, pwede na siya. You can just write a prescription. Ano sa may mo prescribe na ko? Over-the-counter drugs. Over-the-counter lang. Mga paracetamol, pwede na siya. But of course, with other drugs nga nanay specially regulated, dili na ka pwede ito. Because you need to have an ISO for that in order for you to be able to dispense those kind of drugs. So job-related personal characteristic most often cited among The rural therapists were flexibility, confidence, assertiveness, outgoing personality, autonomy, ability to network, lateral thinking, knowledge of community, culture, and ability to cope with isolation and rural lifestyle. Mo na siya. Can you live with the isolation? Okay, ikaw ra gud isa dito. Siyempre, kung naa ka sa imong balay kinsa may imong puy-an, ikaw ra gid isa. Wa kay lain kauban. Tapos na puminyo ka. Ubanon nimo imong asawa. Pero kung ulitaw ka dito og dalaga nya naama sa kay nana. Makaminyo because community, no? Those are example no sa mahitabo sa imo. Uh, in our place, we have an area or a place where most of the First Nations live. No? When you say First Nations, that is referring to indigenous people. No? Kanang lumad yun ra ng mga tao. Okay? Nana sila. Kung sa Australia pa, ginatawag nila Aborigines. Sa Amerika, na silang mga Indian. Nana. So, na yung mga missionary, doktor, gikan sa so usually pinakamahilig magpadala og missionary sa una ng mga doktor, mga inana is Mormons even up to now no nga ang style sa pagpamissionary sa Mormons is they will work for a year. So tanan nila nga income ana sa isa ka tuig ilan na tigumon mo na gamiton nila dayon pag adto diri sa mga areas kung asa sila ipadala mag-mission. So, mo to ilang gamiton no? Pag-mission ano sila kondo. So sa dagdugay na ay Amerikana nga adto didto naminyo na gid siya og lokal. Kaya na in love man siya atong among term ate man na no? Ang mga tao nga itom nya kulot og buhok. Pero di sila pareho sa Amerika nga tag-as ng mga mugbo. Di gid siya mugbo. Siguro na naman sa mga 5, 5'5". Normal ra pud nga pero itom no. So kung i-compare nato sila sa mga itom nga naa dito sa gawas, medyo ubos ang ilang height. So to cope up isolation, ang himo naminyo na lang pud siya and to improve pud sa iyang communications. Okay, tudloan niya iyang bana sa pag-istorya, gitudloan pud siya sa iyang bana sa pag-istorya. Tudloan niya in English sa iyang bana, di siya pud gitudloan. Later on, nakapanganak sila din, gidala niya iyang anak mo, nibalik siya sa Amerika, dala niya iyang bana. So, nana. So, sometimes there are a lot of ways of coping to isolations. Layo ka, so of course, karon dili na kayo kang kaya na cellphone, na internet, na data, no? Pwede na ta mag-video call. So, generalist as specialist. Generalist as specialist practice is a hallmark of rural practice. Mao gid siya kasagara. Paadto nimo dito general ka of all trades. Pero ang practice nimo specialist. Kaya nga naman, doktor ka. Pero mahimo kang specialista kay nga no, magpa-dressing. Unsa na may imong role? Nurse. Kung PT ka, mana nimo dra, magpa-wound care, nurse ka. Anak nimo bata, magpatuli, o nurse na pud ka, o doktor, di ba? Surgeon. Di mana pud mo magpa-rehabilitate, PT na pud ka. Magpa-counsel, social worker na pud ka. So you become a specialist. O, di ba? Jack of all trades, master of none. So the word the best captures generalist specialist practice is varied. So varied ang imong pagka-specialist. Varied can refer to locations, developmental stage, or nature of disability of the client's work. So inana, so depende sa client kung sa imong kung sa iyang kinahanglan sa imo. So dito ka may imong specialist. So generalist as specialist practice necessitates a breadth and depth of knowledge and skills that is facilitated by supports. These supports include a solid network of colleagues who are easily accessible for informal consultations. So kung bintaha ko na kay mga colleagues no nga kuan nga expert. So you just can simply tap them. Pangatanan dayon ka dito unsay ako himuon ani ana ana tudloan dayon ka, di ba? Gani bintaha karon. It's easy to communicate with them. Before you have to write pa, di ba? Sulat pa, telegrama, and it would take weeks to nga maabot din weeks pud ang reply. So, nana, the successful journalist as specialist is one who can use technology creatively to connect with others, who embraces creative and flexible problem solving, and who integrates the concepts of lifelong learning and reflective practice as central essential tools for identifying the needs, determining strategies, and evaluating the outcomes. So, inana, ilan kabalo ka mag-utilize sa technology? No? Technology. So, karon ana pod, ba? Tagaan ka assignment sila kabalo ka magamit sa internet. How will you look for your assignment sa student pa lang? Nga ang imong assignment nindot tagaan ka o nga mag-formulate kag exercises. So, kay mga names sa exercise. So, when you go to the internet, you ask unsa ni siya nga klase, di ba? Ana dira mag-ingon siya nga ah mag-ingon siya fast feed, highness, mga ana. So, nanay mga term yung pinagamit nila dito. Mga trunk twisting or reverse crunch. So, pag ang mga term. So, all the way yung tan, that's only a name. But, hey, kung di mo na siya basawa, makayong social ni akong PT, social yun ka, ikabalo sa mga term. It add colors to your profession. No? Okay, so healthcare concerns as part of your rural practice. So the health and well-being of the native people is dramatically lower than the general population, as indicated by reduced life expectancy, increased infant mortality, increased prevalence of chronic diseases, including diabetes, greatest frequency of suicide. So these are people who are belongs to the First Nations, or we call this as indigenous people or people that are marginalized. So ilang concern is nag-decrease ang ilang life expectancy. Which is contradicting to sa gidiscuss na ko last time, di ba? Nga dito sa community sa city nagataas because they are what? More concerned na sila sa ilang health. Pero dito sa rural areas, kay dili pa man ang information dili kaabot sa ilaha. So nahitabo mo inana, ga-decrease ilang life expectancy. Ano na, let's take for example, mga anak sila ra. So unsa man, at risk ang mama. Imagine mga anak mag-labor, mag-hemorrhage, wa gid siya tambal dira nga ko ang painom, ang ipainom, herbal ra pod yan. Effects herbal bata kabalon sa to. Pagpanganak pag yun, yan ang mortality from the infection. No? Prone sa infection. Ubang gani, pagpanganak bata pa, siya nagipang pahid-pahid. So, ano ba? Chronic diseases. Okay, siyempre ang ginakaon. Ang habit, gamama, maskada. So, okay, siyempre, ang sakit, anak. Sakit sa ngipon, daot ang ngipon. Diabetes, kay siyempre, ang ginakaon, adlaw-adlaw, tubo, and greater frequency of suicide. But of course, sa US, dili kayo na siya kwan ang tubo. Usually, kasi makakause of diabetes dito. Ang ilahang corn, mais, corn syrup. No? Muna'y primarily dito sa kwan. Plus pa nga, GMO pag yun ang ilahang corn dito. And also, frequency of suicide. Daghan nag-suicide yung mga natives. Oh, pero dito sa Philippines, di makain na sila, no? Kaya na mga mission schools dito. Ang ilan lang is usually gina-recruit sila sa mga NPA. Those are common problems. Sa ato diri sa Pilipinas, usually ang mabangga dito ang mga community health workers against NPA. So ikaw po na usay ang imong kinabuhi will be in danger. Kidnapong ka kay nagpinasilay dito then walay mo threat sa ilang kuan. Kidnapong ka kay para tambalan to. So, yun na. So for indigenous people around the world, colonization has resulted in erosion of the traditional culture, marginalization, discrimination, and consequently ill health. So na good effect ang colonization, although it destroys the culture. Pero nasa good impact ba na ang health practice na usab na improve, no? So meeting the healthcare needs of these people while ensuring respect for and preservation of their unique culture is a challenge. Basic tenets of health promotion and illness prevention clearly recognize that the health status and health services needs of a community cannot be separated from its socioeconomic and cultural context. Ito na siya, no? Like, respect na to ang ilahang culture gap. That's why sa hospital, if you go, okay ra diri no kay naman sa city. And we are trying to do that. No? Why? We have what you call uh, cultural competency. No? Apply na na siya dira. You have your cultural sensitivity, awareness with regards to the culture of these people. Di ni mo katawaan niya. Obvious na kay nga murag makatawa ka kay tingala ka. Pero utong-utong na lang na. No? I will cite you one example. Dira sa hospital mismo, no? Ano hitabo? Uh, ang karaan nga bedpan, karon makita nyo na siya ang bedpan green na plastic, no? O, kung naasa ka mangihi, malibang. Sa una, ang karaan ana stainless. Ang color ni ang iyang shape dili pa medyo pa pagka triangular pero dili inana. Gyud no. Ya bukat dagko. So may pasyente nila tigulang. So kuan man gina ay dili naman siya kabakod, dili na kuan so gitagaan silang bedpan. So ang nurse kami pod na shock. No, pagsulod silang room kay ang bedpan gigamit niya yahong butangan sa giting nagluto og noodles tapos ang noodles dito giyabo dito gahigop og sabaw. Imagine niyo pa bedpan sulod dito ihi sa pasyente niya. Although gikan to siya sa CSR bag-o pa na wala nila gigamit din. Pero sa sa iyo nauna ni mga bedpan to lain kayo. No? So, but you have to respect that, no? Do makapahiyom ka pero taguin na lang imong pahiyom. So First Nations, so people both in rural and urban centers have healthcare belief systems that may differ. Sa mga, di ba, sa mga First Nations or indigenous people, let's take for example, gihubagan sila kamot. Iban mo ingon din nga, nakanasumbagan dito nga pan. Pero sa syudad, magkaingon ta nga, ihubag ang kamot niya, ikuha kaayo. Okay, ato ning ipacheck. Tanaw dito kay mubo day siya albumin. Or, pwede nga, saman, napakanda ito siya o mananap, no, ay siya kabantay, no, na-infect, no, munang nihubag. Pero dito sa bukid, ay nakapaak, na kaya sa dra, may nga nakasumbag kag duwindi, nakasana. So, di ba? So, lahi ang belief nila dito sa healthcare system. Sa First Nation o sa kaning nasa urban areas. So there is also incentive to improve the quality and the access to healthcare services for First Nation people. Basic differences between native and non-native healthcare providers in social structure and communications. patterns or potential barriers to the structured communication patterns or potential barriers to the effective acquisition and integration of health knowledge. So kasagaran na gyud no. Ah, Siyempre adto tag Amerika. Kumanto ka dito sa ilang mga First Nation people unsa may language nila. Lahi no. Naa sila kaugaling language sa mga Indian, Reds, no? Navajo, sa mga Indian sila dito. So naa sila kaugaling language. So first ma-ultrasize ka kung maadto ka dito directly kay ngano man dili maka-Indian. So it takes time for them to trust you. Mo magyapon na diri sa Philippines kung maadto ka dito sa mga bukid nga area. No? So First Nation people set example of paternalism and discrimination arising from healthcare workers, lack of cultural sensitivity that impede the ability to access quality of medical care. Specific education is essential to ensure healthcare practitioners are efficient, effective, and competent in serving the needs of First Nation people. So inana siya. So kilala siya special skills. So that's why sa ato gani no. Sa ato specifically sa SDA butan nato sa education. Adto ka dito nya dili ka train lisod. O teacher ka pero you need to have a special skills in order to approach them para mag-eskwela sila. That's why we have what we call Soul Lads Missionary or 1,000 Missionary. So, ikaw, pananglitan, pagka-graduate nimo karon as PT, maadto kag 1,000 Missionary, pintahan na ka kay you have now the basic skills, no? So, ang imo na lang is ang communications. I-develop nimo para ang imuhang mga area kung asa ka maadto, mahimo kang effective communicator para nila. So, inana. So, muna ang mga doctors, mga kwan, muna kasagara ginakuha no, as missionary, padala sa laing lugar. Kaya nga no, they have now the basic skills. Ang health ng approach is one of the effective way of breaking the barriers of these people. Ang ato lang problema is communication. Saan mo ito pag-communicate sa ila? Kay siyempre, maalang alam mag-in-English ka dito. Nya ang ilang lingwahe, dili English. Di sa kasabot sa English. Basta adto kag Korea. Mag-in-English ka dito. Maingon sila, no English, no English. Patay. No? So, ganyan, kabalo ka. So, mag-basic ka Koreano. Eskwela ka. O language. And then, the literature, no, sa rural fieldwork experience, the literature suggests that those students who participate in rural fieldwork experience are more likely to choose to practice in rural environment. Inana, kung nasanay ka sa mga CBR na work, mas ganahan po ka sa rural or sa na trabaho. Inana siya. So, kung ikaw nasanay dito, kita kang trabaho, kay problema, sapot may inig na ka sa syudad kay mo manay mong life, di ba? So, inana. That's why karon kung maantuhan sa gawas, ang rate nila sa rural field work mas dako kaysa dito sa city. No? In terms of benefits. Okay, ilang nakita nga gamay ra ang venture dito kay ganahan gyud sa city kay ang comfort na man dito. So there are a lot of strategies in coping with isolations kung ma-assign ka sa rural areas. So, such as teleconferencing, video conferencing, and synchronous and asynchronous use of World Wide Web to reduce the effect of distance on satisfaction with practice. So, ana siya, no? Utilize with ang okay dito sa US kay nga naman halos na na conferencing area, no? Although na mga dead areas yapon. Just like pero dito sa Philippines mas dagan ang dead areas. Wala signal. So, comprehensive program, so clinical skills. So, these are the way, no? Unsa na to pag-improve sa atong uh, skills. So, as a students now, you are trying to have skills classes. So, daghan. Ang problema lang kay ang estudyante dili mo attend, na ipipindili tanan. Wellness, dili mo attend, absent. Cardiopulmo, absent. Rheumatology, absent. So, ano to pagka-enhance sa inyong skills, ana? Magsige naman lang mo ginabsent. Sa walay F to F, may tag F to F. Something, nanay F to F, magsigig absent. So, makapangalot na lang tag-ulo. Clinical field work in rural communities is very different from that in urban centers. Sakto yun, mao na siya. No? So, mo na siya class. So, again, thank you very much sa pag-watch ani o pagpaminaw. I hope na nakahatag ni enlightenment sa atong una-una when it comes to rural healthcare or sa atong profession as a physical therapist. Thank you very much and good day.